So hi, everyone. Welcome to Ask the Practitioner. This is the first time we're doing this in quite a long time, and I'm now being joined by Dr. Stefanie Haris. I used to run solo on these types of things, so I'm really excited to have Dr. Stefanie Haris here with me. She joined my clinic about a year ago, and I'll stop sharing the screen in a moment, but just to give a brief introduction to what we're going to be doing here with these sessions. The Ask the Practitioner sessions are an opportunity for folks out there to ask some, approachable questions, nothing too specific to your own health history that's very identifiable to you, but asking some questions that we hopefully will be able to answer. And if not, we can certainly try and take it offline with you. We are doing this on a first come, first serve. We're going to try and keep this as close to a half hour or 35 minutes as possible. So we are asking everyone to put your questions in the chat. We will not be unmuting tonight just for simplicity and to keep it very streamlined. So if you do have a question, please put it in the chat. I did also already get 2 email questions sent to me today. So those are jumped in the front of the line. But I do look forward to answering your questions. Dr. Haris and I will be kind of bouncing back and forth between the two of us to answer your questions as best as possible. This is going to be also posted on YouTube. So hopefully you'll be able to go back and listen to it if you have to jump off for any reason, or if you wanted to go back and listen to an answer that we had. So I'm going to unshare and I'm going to get everything set up here. And so hopefully you can see both of us. And again, so I'd like to just introduce us. I'm Dr. Wendy Romig. I am the founder of Sage Integrative Health. And I've had this clinic for about, actually a long time, for like 12 or 13 years now. It's been a while, and I'm really excited to be here with you. The pandemic puts me into a bit of a quieter mode. I was just doing a lot of in-person or a lot of Zoom visits and didn't do any teaching. I used to teach probably at least a class a week for many years prior to the pandemic. So I'm really happy to be back out, at least via Zoom, to be interacting with all of you. I'm a doctor of clinical nutrition, and Sage Integrative Health is really a functional medicine practice. So we really specialize in trying to get to the root cause of any health issues that are happening. So what are those underlying imbalances that are occurring? The interventions that we work with are really in the scope of nutrition, herbal medicine, and some supplements, plus lifestyle recommendations. So that's kind of what we do here. And I'm thrilled to have Dr. Stefanie Haris with me. And like I said, she joined the clinic about a year ago. So I'll let her introduce herself.
Yes, hello. Thank you, Wendy. Yes, my first time doing this ever. So I met Dr. Wendy Romig. We met through our DCN program years ago now. And yeah, we were both getting our doctorate in clinical nutrition at Maryland University of Integrative Health. And we were just in such close proximity. I'm in Philly, she's in Philly, Mount Airy, not far. So it just kind of worked out when I was looking for, residency and, after graduating with my degree, a spot to join. And Wendy's clinic was very much in line. I think we're both in line with our functional medicine practice and, how we view nutrition and overall lifestyle and functional medicine, how that applies. So yeah, I joined about a year ago, and it's been wonderful working with Wendy and meeting all the wonderful clients and clientele that she has at the clinic. So
great. Thank you, Stefanie. So we're going to kick it off. I see a bunch of things coming in the chat already. So the chat is lighting up. I am actually going to jump, as I did mention, 2 people jumped in the front of the line and did submit questions by email. Just for those of you who are joining, just to reiterate, we are going to keep everyone muted for this session. It's just going to simplify the process. We won't be doing any raised hands, anything like that. Just put your questions in the chat and we will do our best to get to them within this next half hour. So the first question that came through via email was asking for herbal protocols for vasovagal syncope, which is For this person, it's triggered by pain and cramping during menstruation. And so for what those who do not know what vasovagal syncope is it's basically when you are passing out in response to something. So some people might pass out at the sight of blood. There's some sort of, some sort of nervous system reaction to whatever's happening in the body, and it causes the body to, the blood pressure to drop suddenly and then pass out. So here, for someone that's experiencing menstrual cramps and they have this symptom of passing out, of course, in the functional medicine field, we're going to be looking not at the symptom of passing out, but we're going to be looking at the symptom of the menstrual cramps that are triggering this. And when someone comes to us and they're presenting with a lot of menstrual imbalances, cramping, heavy bleeding, heavy clotting, a lot of PMS, we're going to be looking to see what are the hormonal imbalances that are happening. And for this person, obviously, we don't have a full health history. She submitted just a one-line question. So the best answer that I would be able to give for that, especially since she requested some herbal remedies, would be, I'd say, let's take a look at the cramping and what's going on there. Is there something that maybe an herb like chaste tree could be addressing to help bring progesterone up? Oftentimes, heavy menstrual cramps are due to an imbalance between progesterone and prostaglandin. And so if progesterone's a little bit low, prostaglandin can get a little bit high and cause excessive cramping. So we want to just take a look at that and maybe look at progesterone, elevating progesterone naturally through something like a chaste tree, and maybe even talking a little bit about seed cycling. Seed cycling is something that Stefanie and I do with our patients that are trying to do more food-based ways of increasing their hormones. And it's just doing like 2 tablespoons of sesame, sunflower butter, or pumpkin seed butter, sesame in the form of tahini usually, to every day. 2 tablespoons can help increase progesterone because it provides those healthy fats to make the progesterone. So, and the other component is just making sure that there are no electrolyte imbalances. So with this person that's passing out, I'd want to make sure that the blood pressure isn't running low anyway. So we might want to check to make sure there isn't an adrenal issue, to see if the adrenals are not producing aldosterone, which keeps blood pressure balanced enough. So we might want to balance the adrenals, and there's a lot of really great herbs for that, maybe ashwagandha or eleuthero or something like that. And we might also want to look at just something basic like an electrolyte drink, which a little bit of salt and electrolytes can help also balance that blood pressure. And so, of course, all of the things that we're discussing here today, these are recommendations kind of in a vacuum. So please, with serious conditions, we do recommend that you speak with us or speak to a healthcare practitioner before diving headfirst into some of these remedies, because herbal medicine is a potent healing modality that needs to be used cautiously. So those are kind of just some caveats to all of this before we get too deep into some more recommendations. So hopefully that answers the participant who wasn't able to, or I think she might be on, but she wanted to put that in advance. So the other question that I got kicked over to me today was a little bit more complex. She had a couple of questions with struggling with depression and anxiety. Her appetite disappears. She has difficulty cooking, when she's in a low mood. She has a lot of sugar cravings. So this, in a nutshell, to me, is going to suggest that the stress, the adrenal cortex, the adrenal response is suppressing her appetite. When the body has a high adrenal response, which is triggered by cortisol or triggered by stress and anxiety, you're going to be releasing cortisol, epinephrine, norepinephrine. These are all kind of those fight or flight hormones. Cortisol is also a blood sugar hormone too. So cortisol increases the amount of glucose going into the body. Epinephrine, norepinephrine, what they do is they activate the sympathetic nervous system, which is that fight or flight mode. When the sympathetic nervous system is activated, it decreases digestion, right? So it's going to decrease the appetite naturally when we're under a lot of stress, because in fight or flight mode, we're like, who cares if we're digesting our food? Like, we don't need to eat. We need to focus on getting out of the situation. Of course, this is talking about prehistoric days when we're running from saber-toothed tigers. not in the modern day world where we're looking at an email or a text message that really upset us. So it's a little bit different, but the biological functions are still very much the same. So with someone like this, we're going to be looking to say, okay, let's support the adrenals, and how can we help reduce cortisol? Because if her cortisol levels are very high, it's going to increase her blood sugar levels. Increased blood sugar levels is going to also cause crash and burn. So there's an insulin demand as well, which also increases the demand for more sugar in the body. So it creates cravings. So it all kind of ties together. We've got stress and anxiety. We've got adrenal response, which is decreasing appetite, but the cortisol is increasing sugar and sugar cravings. So this is something we're going to want to look to balance with maybe some adaptogens for the adrenal glands, looking to see how can we decrease the stress and anxiety. And Stefanie talks about tapping a lot, because she actually brought that into our clinic, and it's a fabulous technique. So I definitely would recommend, we would recommend tapping methods, and maybe even some passion flower or valerian and things like that. And then when going gets tough and the tough can't get cooking, it's, I get it. So thinking about simple, easy to prepare meals, and maybe even doing some meal prep that you can have in the freezer that you can just easily pull out to make it more accessible when you're having those low times when you just don't have the desire, the motivation to cook. So these are some very simple recommendations, and hopefully the person that will be seeing this video on YouTube later on will find that to be valuable. So like I said, the chat is firing up here. And we have a question: should avocado oil be refrigerated? So it's, Stefanie, do you want to kind of take that one?
Yeah. So it doesn't say on the container, and I honestly don't refrigerate my avocado oil. I do know, for like seed butters and like seed fats, they can go rancid. They're a little bit more, you have to be cautious and put them in the fridge to keep it long enough. But I think avocado oil, through the processing, it's pretty stable. It's also very high heat stable as well. So it is, kind of a little bit safer to kind of keep it out of the refrigerator, I would say. And the next follow-up question is avocado oil healthier choice of fat when making rice? I think, there's our view kind of on fats is you want it to be, a pretty high quality fat, and you kind of want a variety from different plant bases, some clean animal, like, ghee or grass-fed butter, that kind of thing. So it can be a healthier choice when making rice. But I like to think that, having a variety of different, like, omega-3s, 6, 9s, all the good things that come in fats, is important to keep in mind as well.
Yeah, I agree. I think, there's a lot of different healthy oils out there, and you can definitely, a rotation is a great idea. So switch it up. It's fine. Avocado oil, extra virgin olive oil is harder because it's not as high. It's not recommended for high heat. It does have a lower smoke temperature. So just looking for those higher heat, like Stefanie said, ghee is great.
Coconut oil.
Coconut oil is a high heat oil, avocado as well. So you're looking for some of those. For heavy heat cooking, you're going to look for those more stable oils. So great. So we have a question. Any generic nutritional recommendations for coming through COVID other than listening to one's body, making fresh green leafy soup? So nutritional recommendations for COVID. Yeah, I think we can bounce back and forth on that one, Stefanie. I think, coming out of COVID, you're going to want to make sure you're getting good proteins, but also a lot of antioxidant foods and foods that are higher in zinc. So you're going to be looking at seeds and some nuts. Beans have a lot of zinc in them, and grains. Definitely your dark leafy greens is a great way. But if you're just on the other side of recovering from COVID and maybe you're still symptomatic, light. Keep it light and brothy, like you had mentioned. A fresh green leafy soup is a great thing. Maybe you want to do like a miso broth or something like that, which will give a little bit of a probiotic and not overwhelm the system too much. So, but again, getting a lot of the antioxidants in there, we want to just boost your immune system with a lot of vitamin C and other phytonutrients. So, and of course, coming out of COVID on the herbal side of things, there's a whole host of things to boost the immune system. But on the generic nutritional side of things, that would be kind of a recommendation. Stefanie, do you have any?
Yeah, adding to that, if meat's in the diet, I would say some bone broth, again, to get these proteins, these other kind of healing, anti-inflammatory, things into us as best as possible, along with, some of the herbal supports, even, the dietary herbals, so some ginger. It also kind of depends on which symptoms of COVID you were dealing with, and yeah, kind of just where you're at. Like you said, listening to one's body. So kind of getting in tune with what your body needs to be supported at that moment.
Absolutely. Absolutely. So next question, any recommendations for kids multivitamins? So I'll tell you my canned response, but Stefanie has a daughter. So I'm going to tell you, I like Smarty Pants a lot, but Stefanie will have some really good insights on this one.
Yeah, so I guess the short answer is whichever one you could get in your child, because it's not always easy. I've gone through a variety of multivitamins, usually gummy based, but there are some chewable ones out there, and even liquid, multivitamins out there too that can taste okay. Children's multivitamins, generally, if they have a relatively balanced intake, they may not be necessary unless there's like concern of, again, getting the nutrients in, or if some sort of labs come back saying there's some sort of deficiency. Let's see, my daughter eats, I'm trying to think, I'm completely blanking on the name, but it's a gummy one found at Target. It does have a methylated B vitamins in there, which, that's just something we likely do with multivitamins sometimes. And it's just kind of helps support methylation process that I think it's like 60% of the population has some sort of genetic SNP that affects methylation, which affects, everything from cellular functions, DNA synthesis, that kind of stuff. So they are out there, and I'm sorry, I'm blanking on the names right now, but it has an owl on it. We call them the owl vitamins. They also have some fish oil, these multivitamins. So it's kind of a nice balance, full of everything and relatively tasty for my child to eat. So
good. Yeah. So that's a good recommendation. Sometimes kids are picky and they won't, you think you have the best multivitamin that research provides and they won't take it.
Yeah.
So you do have to go along with that as a little bit as well, especially if you do have a picky eater and they're not wanting to eat all the fruits and veggies. So multivitamin at a young age. For adults, multivitamins, not a big fan, but for kids, it's not a bad idea to round out nutrition. So good. Christopher has a question about mold toxicity. Oh, this is a big one. We could do a whole 2-hour session just on mold toxicity. And we do have a lot of patients that come into us that have had a mold exposure, either current or sometime in the past. And one of the ways that we test for mold is we can run an organic acid test, which is a urine test. The organic acid test does give some mold markers, and there's one that goes a little bit deeper even from that, which is the mycotoxins panel. And the mycotoxins, also another urine test. And the mycotoxins panel gives us a breakdown of specific mold species, which is really helpful because it actually can help to narrow down where the mold's coming from. Now, for someone who knows where the mold is coming from, I've had mold exposure in my own life and I've dealt with mold toxicity. It's not fun, not fun at all. And I've dealt with many people over the years that have had mold toxicity. So this is definitely something big time in our wheelhouse. The first thing is to get yourself out of the situation, right? So, mold toxicity can only be dealt with if you are no longer being exposed to it. So first and foremost, get remediation done. It is expensive. It's a bummer, but get it done. You have to. It's very, very bad for health, and it can lead to all kinds of problems, autoimmune conditions, inflammation, cancer. There's just a whole string of things of long-term mold exposure. So we want to really get away from the situation as quickly as possible once you've identified that you are exposed to mold. If you know it was a past mold situation where you're like, I lived in this apartment, pretty sure there was mold, it was damp, really musty, lived there for 3 years, moved to a nice clean place, mold can actually kind of still hang out in the body. So, we might want to look at some detoxification and clearing the mold out of the body using some antifungal remedies. And we work with a couple of pretty strong ones, but like golden seal black walnut, pata arco, those are all really very potent anti-mold, antifungal agents that need to be used very carefully and with a proper protocol. But they are definitely some things. Plus, you can also just do some basics with like improving liver detoxification. Some practitioners use activated charcoal. It's not something we use really in our clinic. We work with more of the herbal side of things, but that is one that comes up a lot, is activated charcoal as a way to kind of pull the mold out of the system too. So there are a lot of different options there, but again, stop exposure first, and then you'll have to work on getting it out of the system, and then also deal with any fallout if you were experiencing any other issues as a result of the mold, like histamine issues is a big one. A lot of people start developing food sensitivities and they're like, I don't know why. Suddenly I can't eat this food anymore. So starting to address some of those underlying issues, and probably there's going to be some gut issues too that come up as a result of the the mold exposure. So Stefanie, anything to add to that?
No, I mean, you pretty much touched on it. I think identifying kind of where the mold is, if and getting rid of the exposure is key, because you can't really move on from that so much if you're still exposed to it. Same with any other kind of toxin exposure. And then, yeah, like you said, supporting detoxification, food, nutritional supplements, other kind of, lifestyle type things you can do to kind of help support that too, with some IR sauna, sweating, things like that. There's a lot you can kind of put into play to kind of help support the body through that.
Yeah, absolutely. Those are really great lifestyle recommendations. The saunas are great. It's a really good way to help the body sweat it out. If you're not a sweater, you get it out of your system, just sweat it out. Great. So hopefully that answers your question. I got a question here. What are the best vitamins and herbs for seizures? So one of the things is what's causing the seizures. So again, as functional medicine practitioners, that's our first question, is why are the seizures happening? If you kind of look at just the symptomatic approach to seizures, from an herbal perspective, I would be probably looking at something like a blue vervain, which is calming to the nervous system. CBD is actually something that comes up frequently for seizures. So that would be very much in the line of vision for someone that was presenting with seizures. But again, we would need to figure out why the seizures were occurring. If it was a diagnosis, if there was the seizures were, they weren't tied to anything. It was kind of a secondary seizure to something else. We would need to just figure that out. Again, the herbs like blue vervain, CBD, these are things that we're wanting to kind of calm and soothe the nervous system. And I know blue vervain specifically is something that's more targeted for seizures. On the supplement side of things, well, we want to look at things that are helping with healthy nerve conduction. We want to look at omega-3s, making sure the B vitamins are balanced. And so just having a methylated B complex in there, an omega-3 supplement, those could be all useful interventions. A lot of functional medicine practitioners might start getting into some of the amino acids and GABA and things like that. Those are an approach. We tend to use amino acids maybe in a very targeted way, not as much. I mean, GABA can be used, but we have to be really careful with amino acids because they are so strong and they are very potent. They're very targeted in their biological effects in the body. So I tend to lean more on the herb. I'm an herbalist at heart. So I always tend to go more into the herbal side of things. So yeah. Anything else? I don't know if you have anything else to add.
No, yeah, again, it's, trying to figure out kind of where the dysfunction is, where the imbalances are, that may be contributing to the seizures,
Mhm.
and kind of supporting the root cause. Yeah.
Looks
Causes.
like we have someone that is crashing in the session here. But we're just going to deal with it. I apologize. In the chat, it looks like someone is crashing. It is picking up. I'm not sure what happened, but let's move on to the next question. How to remove parasites from the body. So the first thing, how have the parasites been identified? If it was a stool sample, could have been, if it was stool culture from your primary care physician or from a GI doctor, bringing that in, let's see what it is. The best remedies that we use really for parasites is golden seal, black walnut, wormwood. Those are kind of the typical, the typical interventions that are being used for their anti-parasitic. Black walnut and wormwood are especially known for their anti-parasite qualities. So that's what we would want to be doing is something along those lines. And they are very potent. It does take some time. So the conventional approach to removing parasites is usually some sort of antimicrobial, fluconazole or something like that, or and they can work. So if you get it identified as something that's a recent parasite infection, that actually sometimes that's the better approach. If it's something that's been hanging out in there for a few years and you've been having lingering IBS, diarrhea, you get diagnosed with like Crohn's disease, then we might be looking at that there's some sort of chronic infection happening. And that's when we might really dive into the herbal remedies. Golden seal, research on golden seal suggests that it can pierce the biofilm. Biofilm is kind of like a little veil that bacteria, fungi, and parasites can hide under and escape notice from conventional interventions. So golden seal can help potentially with that. So hopefully that's a kind of very simple approach. Also, keeping a good healthy diet, and maybe Steph, you want to talk a little bit about some of the dietary support for that.
Yeah. So again, depending on what parasite is, but in general, we want to just support elimination, kind of supporting the gut, with making sure we have plenty of fibers and proteins, kind of balancing the intake with a variety of nutrients that's going to help support and be gentle on the gut, but also kind of help support elimination as well, because as we're addressing them with antimicrobials, we do want to make sure we're ridding the body of them as well. So I think fiber is important, as tolerated, obviously, depending on how the symptoms are showing themselves from the parasitic infection. But yeah, some sort of microbial support to the microbiome too, to kind of keep that strengthened as we're kind of working to remove any parasitic.
Yeah, and that's a good point. There are some studies showing that certain strains of probiotics can be beneficial. So L-rhamnosus is something that can actually be taken prophylactically prior to going to a trip to prevent parasite infection. So if you're traveling to South America or to India or someplace where parasitic infections are common, that you can take L-rhamnosus prophylactically, as a preventative measure to hopefully prevent any kind of infection. So that's something. I actually have a patient that's seeing me regularly, and he's traveling to Peru, and he has pretty severe GI issues. And so I put him on L-rhamnosus to prepare for his trip. So that's some new research that's coming out. It's always exciting to see what's coming out in the research. So it looks like we have one more question, which rounds it out because it's 6:30. So Steph, why don't you take the last question, which is how to detox for inflammation?
Yeah.
It's a good one.
So yeah, antioxidants. Antioxidants are very useful for helping to bring down inflammation. So getting them from, like we like to say, eat the rainbow, kind of making sure we're getting, fruits, vegetables, different colors, getting the phytonutrients to help bring down some of the inflammation as well. Again, quality proteins and fats are super important for the body to also kind of fight inflammation. Making sure our blood sugar is balanced, supporting, all sorts of body systems, the liver to help with detoxification as well. And yeah, helping with elimination with other kind of lifestyle things.
Yeah. The other thing too is we want to figure out where's the inflammation coming from. So, the detox protocol is really dealing with any inflammatory responses. If we deal with a lot of gut issues in our clinic, and they are very much a source of inflammation, and they can definitely contribute to autoimmune conditions. So, if we have some coming in that's showing a lot of GI inflammation, then we're going to be looking to see if there is some sort of fungal or microbial imbalance that's contributing to this inflammation. Someone that's experiencing a lot of joint pain, again, looking there to see what's going on. Is there any kind of toxic exposure? So we look at the detoxification of toxins in the body. So we want to increase liver detoxification pathways, making sure that phase 1 and phase 2 detoxification are solid. Phase 1 is, basically taking it, converting it to a fat. But if phase 2 is not working, then we're going to have an even more toxic substance in the mix, which is very bad. And so we want to make sure we're converting it back so it can get cleared through the body. And so the nutrients that are necessary for phase 1 and phase 2 liver detox are things like Stefanie said, antioxidants. So we're looking at glutathione, we're looking at B vitamins, vitamin C. We're looking at the sulfur-containing compounds in cruciferous vegetables. Those are all things, certain amino acids and proteins, which are helping with phase 1 and phase 2. So we're going to really be making sure we're getting enough of that in the diet, and then dealing with the inflammation at the source and seeing how can we reduce that. If it is toxic exposure, then we need to see if we can take that out. And we do ask, a portion of our intake is asking, do you use a water filter? Do you buy organic foods? Are you using household cleaners that are kind of the grocery store brand? Have you been exposed to pesticides through an orchard or just living near a farm? More than the average person would get from living, just buying conventionally produced foods. So we always, you want to aim to have a detoxifying lifestyle. So reducing our exposure to toxins in all aspects, including emotionally toxic situations.
Right.
So we want to decrease our toxins and also increase exercise, sweating. So saunas are really great for this. So if you're not, if you're not a big sweater, you're not exercising, exercise, which it can induce sweating, helps also the body rid itself of toxins. So we want to really look at the bigger picture. And of course, there's tons of herbs, tons of wonderful liver detoxifying foods like celery, cucumber, parsley, cilantro, all of those wonderful foods that are just known to be liver detoxifier. As we look at supplements like N-acetylcysteine, the sulfur-containing compounds from like the broccoli and cauliflower, we can, DIM is used for women with high estrogen levels. So we can keep those xenoestrogens out of the mix with plastics that are everywhere. Like even this morning I was opening my blueberries thinking, more plastic. I can't get away from plastic. I just wish they had a bin of blueberries and I can just scoop them out, but they don't. They come in plastic, even if they're organic. So, how can we reduce our exposure? So these are some things to consider. And hopefully, like I said, this has answered some of your questions. I know we have to be take a broad sweep over things because we are in a general audience and we're not getting the full health history behind them. But we do encourage you to reach out to us. Everyone can sign up for a 15-minute free consultation. Dr. Haris is taking in most of the new patients in the clinic right now. I'm stepping into more of a clinical oversight. We are in the process of launching a student clinic, which we're very excited about. We have our first student joining our student clinic. I'm starting with her orientation tomorrow, and the student clinic will have reduced rates, so it's more affordable. It gives her experience, and it gives people who cannot afford the slightly higher cost of functional medicine, they can still get the access to Dr. Harris and I behind the scenes with the student, but you're working with a student. But it's a great opportunity to work with functional medicine. And so please schedule a 15-minute free phone consult with us online, sageintegrativehealth.com, and we'd be happy to answer all of your questions. So Stefanie, any other last thoughts?
No, this was great. I hope that, I think in the future, we're going to be doing a couple more of these, answering more questions. If you have anyone else you want to introduce to functional medicine, I think this could be a great way to, kind of let other people know about, how to get in touch with us as well.
What we do. Yeah. So feel free to reach out. It was a pleasure answering all of your questions tonight. We enjoyed the conversation. Stay in touch, and we'll see you soon. Everyone have a wonderful evening. Take care.
Good night.